Hello, my name is Geert van Dijk. I'm CTO of Macawi Medical Systems. Today we want to introduce to you our OEM module, the Macawi Respiratory module. This module is specially designed for OEM manufacturers who manufacture ventilators for the medical field. This module is only about 850 grams and less than 2 liters in volume. Has a very low power consumption. You can use this for medical ventilators from neonatal care, ICU, to transport and emergency care. The ventilator module is designed around this centrifugal blower, which is very dynamic. With this high dynamic behavior, we can ventilate up to 200 breaths per minute and deliver over 200 liters per minute flow and over 100 millibars pressure at sea level. For the patient connection, we have chosen to use standard proximal flow sensor or standard membrane expiration valve, which are cheap but can deliver you high performance. What you see here is a setup with some artificial lungs for a baby. You have here the module. Inside the box is the host system. And we have the screen here which shows you some real-time parameters and real-time curves. We also can show you derived measurements for pressure and volume. And here we have some additional derived data like compliance and resistance. The next screen, what we want to show you, is our settings screen. In the settings screen we can activate all kinds of ventilation modes and we can set all kinds of ventilation parameters. The next screen we want to show you is our event screen. Here you can see all the events coming from the communication to the host, where for instance alarm levels are reached or certain technical alarms are given. The next screen is the service calibration screen. This is for service personnel and calibration purposes. The next screen is also for service and is a screen which shows you some diagnostic information about several sensors and actuators. If you go back to the settings screen, we show you the modes of ventilation which are available, which are pressure controlled and volume controlled modes with synchronization. Further, you can set inspiration time, expiration time, tidal volume, pressure, PEEP, etc., etc. Now we want to show you the option for PCVR. PCVR is pressure controlled, volume regulated. We have set a tidal volume of 20 milliliters, target volume for VTE. We activate now the PCVR option, and in this monitoring screen we can see now what the effect is. Automatically the pressure is controlled until the expiratory tidal volume has reached is set 20 milliliters. In case of a compliance change, I will demonstrate that, the pressure will automatically control to a new pressure set level where the VTE is reached the 20 milliliters. And of course, if I let the compliance come back, the pressure will automatically be controlled back to its old level, where the VTE of the patient is 20 milliliters again. In the device we have a so-called recruitment option. It's possible to do a recruitment maneuver with preset values. We can set a recruitment PEEP, the recruitment inspiratory pressure, the number of recruitment strokes, the inspiratory time and the expiratory time of the recruitment strokes. If we activate the option then, you can see in the screen now the effect of the recruitment. You can see here the recruitment strokes and after that it continues the normal ventilation again. We showed you a few of the many options the device can offer you, and for more information we ask you to look at our website macawi.com.